In health news tonight, we're talking about secondhand smoke once again. According to a new study, it can affect fetuses of women who don't smoke but are exposed to people who do. University of Toronto scientists found traces of nicotine in hair samples of babies born to such mothers. That's of concern, of course, because some studies suggest that children of women exposed to secondhand smoke may suffer developmental problems.
There's more evidence that secondhand smoke can hurt people, even the unborn. Scientists have found that pregnant women exposed to smoke are also exposing their babies. Medical and Science reporter Bob Aldridge has the story.
Researchers report finding evidence of cigarette smoke trapped in fetal hair. It's the first biochemical proof that the offspring of smoking and even non-smoking mothers can be affected.
Even passive smoking on a regular basis near a pregnant woman would cause accumulation of toxic compounds in the unborn.
Dr. Corin's team found traces of nicotine and cotinine in the hair of 23 newborn babies whose mothers were exposed to cigarette smoke either at work or at home during pregnancy. The hairs were clipped between 1 and 3 days after delivery. Nicotine is known to pose considerable health risks in developing babies.
Well, we know that nicotine is a direct vasoconstrictor of the placenta. What that means is that the blood flow is being limited to the developing baby. That can limit the amount of oxygen that the baby receives and so limit growth potential.
Nicotine from smoke is broken down in the mother's body to a byproduct called cotinine. Both circulate through the mother's blood and are passed to the fetus through the placenta. Exposure to smoke during pregnancy is associated with a number of health risks in infants, including premature birth, low birth weight, and sudden infant death syndrome.
It's true that babies born to mothers who smoke have a higher incidence of respiratory infections in the first 2 years of life. We don't know whether that's due to smoking before birth or after birth, but it's probably a combination of both. It's also well known that babies of mothers who smoke have a higher incidence of ear infections.
It had long been suspected that secondhand smoke affected unborn babies negatively, and now researchers appear to have demonstrated that that effect is measurable. The Toronto study is reported in this week's edition of the Journal of the American Medical Association. It gives expectant mothers more reason to avoid both smoking and secondhand smoke.